North American culture demands us to go, go, go all the time. More is expected of us at work and home than ever before. Most of our daily activities stimulate our automatic stress response. Once the stress response is triggered, our healing mechanisms are shut off. Sleep, digestion, and calm thinking is profoundly disrupted. In the DVD entitled Adrenal Health Stressed Out, Bev further expounds on how life choices can lead to adrenal exhaustion, how overall hormone balance can be profoundly affected, and how to reverse the process.
Welcome everyone to the Women's Health Series, where we'll be talking about endocrinology, that's all your hormones in balance, and how it affects us in our everyday lives. Today we're going to start with adrenal balance and looking at managing adrenal health with natural medicine. I always like to start with getting into the idea of the picture of somebody in vibrant health. So let's just start by looking at the picture of vibrant health so that we'll be able to then compare ourselves to it and see what we need to do to help ourselves. So really the picture of vibrant health is somebody that has abundant energy, that's jumping up out of bed in the morning and doing their everyday chores, getting through their day in a very natural and energetic way. And then at night, they're able to hit the pillow and go instantly to sleep, whereby they will have a very nice solid sleep and then wake up feeling refreshed and relaxed. So sleep is another part of health that's really, really important. Because if we don't have sleep, then we won't regenerate our organs, and then we won't be able to build up our bodies instead of continue to breaking down our systems, which we really do all day, is we sort of catabolize our systems, break down our tissues by using them. And then at nighttime is when our liver, our kidneys, and the rest of our systems go to work to be able to build those tissues back up again. So there's abundant energy, good sleep. We want to have good bowel movements. And as a herbalist, I could talk about bowel movements for more than an hour, but we'll try not to do that today. It's not as interesting to other people as it is to me. But really, bowel movements are important because it is a measure of how our elimination organs are working. Typically, if you have a regular, normal bowel, you should actually have a bowel movement every time you have a large meal. Now, I'm happy usually if people come in and they say they've had a bowel movement once a day. That's really good. And there's no straining, no constipation, or on the other side, too soft, or there's any diarrhea involved, or alternating from one to the other. So this is where bowel movements become a measure of how good our elimination is in our body. And elimination really starts at the tissues, but it also then goes into the liver and the kidneys, and then all of that goes into the bowels and releasing that from the body. The last thing that we want to talk about as far as vibrant health goes is the skin and the complexion. People always mention that people who look like they're in optimum or vibrant health have really good skin. And, you know, I find it really interesting because that just shows us what the wisdom that we have as far as understanding health at a deeper level. Because the primary organs of elimination are your liver, your kidneys, and your gastrointestinal tract, or your digestion. If those are under stress, what happens is that the secondary elimination organs have to take over. And those secondary organs of elimination are your lungs, your sweat glands, and your skin. So if you have sort of pallid skin, if it's not really looking very well as far as color, that usually means that those primary elimination organs aren't working very well. And in fact, if you have skin conditions like psoriasis or eczema or constant rashes, blotchiness, gray color, that usually means that those primary elimination organs aren't working properly. So what we would set to do is to try and help those elimination organs so that we can bring them back into health so that the secondary ones aren't working to pick up the slack. So as we spoke about, those factors that do maintain health again are the primary organs of elimination, starting at the tissues. We've got your kidneys, the liver, and the gastrointestinal tract. But the other ones that are really important are your immune system, the endocrine system, and the nervous system. So if your brain isn't working properly or the peripheral nervous system, then you'll see changes. As well, that immune system, if it's not working properly, it's going to have an effect on the nervous system and the endocrine system. So they all work in harmony together. And there's a really great book called The Molecules of Emotion. It's by Candace Pert. And she's a chemist. And what she did was do studies of the brain to show that, in fact, instead of the nervous system telling the body what to do and it being a one-way hierarchy, what actually happens is that the nerves, the immune system, and the endocrine system have a very intricate feedback loop. And they all talk to each other and adjust as necessary. So this is where the immune, the endocrine, and the nervous system all come hand in hand and have a big effect on your health, along with those primary elimination organs. If we look at the factors that keep us from health, really, if you were listening to the media today, you would think that genetics is the only part of health. We have people that are going out and having preventative mastectomies if they have breast cancer in the family. And that's a cue to me to say that this person really thinks that because of their genetics, they have a very big chance and they will get breast cancer. There is a speaker who's great to hear if you've ever got a chance. His name is Dr. Bruce Lipton. And he talks about the actual facts. Now we know through scientific experiments that perception can actually change your genetic code. And this is really important because what that means is if you actually close your eyes and visualize yourself in complete health, your physiology actually changes in your body so that it becomes healthier. So we can change it by our thoughts. So you know the old adage that things are in your head? Well, I say, yeah, everything's in your head. That's right, because you can actually change the process of disease. And in fact, when you do some of the literature searching about people who have recovered from a chronic life-threatening illness, they actually have said that it was their mind being made up that they were going to cure themselves that made the real difference. So that's genetics. Also around us, and you've heard it over and over again, that environmental toxins are crowding our world and they're getting worse and worse and we really can't escape it. And it's absolutely true. You know that toxins are in the air that we breathe, they're in the food that we eat in the way of preservatives, and they're also in the water that we drink. And so we really can't escape it. It really, really is something we can't do anything about. So what we have to do is try to manage those elimination organs to be able to minimize the toxins in our body. So keep them active so we're getting those environmental toxins out of our system. Also, there's a thing called spiritual wellness. And that may seem at the start a sort of a religious statement, but really what I'm trying to say is that in the past, people have stayed close to their families. They knew their community really well. And that gave people a lot of support for healing. And in First Nations medicine, in fact, it's very important that they look at the universe being healed. First, the earth, then the community, and then the individual. Before the individual can be healed, all those other things have to be in balance. Okay? And I think these days, the thing that's happened is that people are more mobile, they're moving around, they're separated from their family, or they don't have many friends in the area, and that makes them very isolated. And that can limit how well you can heal yourself because it doesn't give you as much support, and you can feel very alone in your situation. Also, what's very important is diet and lifestyle. And let's talk about diet and lifestyle a little bit more. There's sort of two categories that I split the diet and lifestyle into, and that's really if it's an emotional stressor or if it's a physical stressor. As far as emotional stressors go, if we look generally at our society, that our society really doesn't have an emphasis or a value on having balance. We celebrate our CEOs who make lots of money, or the richest people in the world, or we have a lot of emphasis on those kinds of people, the movie stars and this and that. There's nothing to say what the relationships are like. And so things like meditating may not be important, or taking days off. Even our language is all about people being lazy, or, we should push through to our second wind so that we can gain more energy and success. It's not that if you phone up and say, I want a day off, that the person is on the other end of the line is really going to understand, because society wants us to be more productive. And in fact, there's a lot of studies that talk about productivity and how, Canada is less productive than the United States, and, oh, gee, isn't that horrible? But really, we should look at the bigger picture and how healthy we are. So there's a lot of stress in our society to really push through, and it causes a lot of stressors. And we'll get into adrenal stress and how that manifests itself from a physiological point of view. Now, sleep, when it's disturbed, can cause a lot of problems because the body isn't being able to heal itself, as I discussed earlier. So stress, emotional stressors, can cause us to not sleep very well when we're thinking about what we want to do tomorrow, or how we didn't get done what we wanted to do yesterday, or how am I going to get all these things done, and then we're not having good quality sleep. Either having trouble getting to sleep, sleeping very lightly, or waking up really early in the morning. And these are all different types of sleep problems, but they'll all be lumped into one of the causes being from emotional stress. Now, if we look at physical stressors, because adrenal stress can be brought on by physical stress as well. So if we look at our diet, stimulants that we eat and drink, so coffee and chocolate, refined sugar, if you have any food intolerances, those all stimulate the immune system, would then cause the endocrine system to be off. Every time the immune system is triggered, the cortisol is raised. And cortisol is one of the markers for increased stress in your body. So every time you bring a food into the body that you're intolerant to, you could be triggering cortisol. Even though you may not have very many emotional stressors, you may have a lot of physical stress in your body because of cortisol production and because of food intolerance. And also, in physical stressors, I would lump in dehydration. Because people don't drink enough water, enough fluids, the tissues are actually stressed. And then also, you may have sleep deficits because of pain. If you're in constant pain in a joint or an inflammatory process, then it's going to disrupt your sleep. So this is where both emotional and physical stressors can lead or limit us being in that most vibrant or optimum health state. So let's look at one of the key points as far as the treatment of natural medicine goes. And that is really in defining symptoms and how we look at symptoms. In allopathic medicine, or the reductionist kind of method of treatment, when you have a symptom, a drug is usually given to make that symptom go away. It's called symptomatic treatment, and that's exactly how it works at your medical doctor's office. And some would say there's nothing wrong with that situation, and certainly from a symptom point of view, if that irritating thing goes away, it's great for you because now you don't have it anymore. But if we look at the role of symptoms in our body, symptoms are really a sign, a warning signal from our body that something's out of balance. It's going, hello, something's going on, I'm not feeling so great, you gotta fix me. And the key about symptoms is that you really want to look deeper into those constitutional areas to say what's wrong and how can we reverse it so that that symptom will go away. It's not as quick of a fix, but in the long run, it will bring the body back into balance so that the symptom will go away and you'll feel much better in the long run. Symptomatic therapy really doesn't have an end. If you're taking a symptomatic treatment, you will be taking that forever. And the problem with taking away your warning signal is that the underlying process of imbalance still goes on underneath, okay? And that's the danger. So let's just look at hormonal therapy as a whole. all the endocrine organs and how they work in concert with each other. Now, if we start with the thyroid is at your neck here as I swallow a little bit, thinking about it. It's a butterfly-shaped organ, and it produces a thing called T4, or thyroxine. Thyroxine is made in the thyroid, but it needs to be converted to the active form, or T3, in the liver. So the thyroid is a very essential organ as far as metabolism and temperature goes, and it's a very big part of making sure that your enzymes work properly in the body as well. So a very important part of your system. The next organ we want to look at is the ovaries in the women, and it produces estrogen and progesterone. And the ovaries are just a part of the whole picture of the endocrine organs. And you'd think by the way treatment's going on with women these days that the ovaries are really the only thing that matters in menopause. And it's just not true. That if we have the other organs out of balance, the ovaries are going to be bound to be out of balance at some point. So the ovaries are what produces our cycles, and it also allows us to reproduce. That's the basic function of the ovaries. Now, if we look at the adrenal glands, it's got a lot of work to do. It produces cortisol, it produces adrenaline. And adrenaline is really the one that we've all heard about, that adrenaline rush, is that short-term fight or flight response that we get when we're in a really traumatic situation, like we've been in a car accident or we've had a scare of some sort. Then that's when adrenaline kicks in. Now, after a period of time, if you're under continued stress, if the body stays in that sympathetic mode, that's when cortisol kicks in. It's the long-term adrenaline, if you like. And cortisol will be continued to be secreted while you're in that stressful mode, which most of us live in. It's just a fact. We're always in that mode, rather than having a balance of rest and repose, which is the rebuilding side of our system, and that fight or flight response. So cortisol is made by the adrenals, and as well in women, testosterone and aldosterone. Testosterone gives us our libido, and aldosterone balances fluid in the body. So you know when people are complaining about puffiness, I've got rings around my ankles, or I really feel like I'm just holding fluid everywhere in my hands, usually extremities, then that's usually a case of aldosterone not working properly. And then the next organ that I wanted to talk to was about the pancreas, and we'll be talking later about the pancreas and its role in insulin balance. The pancreas, there's certain cells called the islet cells in the pancreas that produce insulin. Now, the role of insulin is to balance blood glucose. And when we're in the fight or flight response, what happens is that insulin is suppressed, because we want all the sugar in our bloodstream that we possibly can. And in long term, that can cause a lot of problems. In the short terms, it's good. If we're in a stressful situation, we need energy, we've got some axe murderer chasing us, then we need to get away and have lots of glucose in our system. But in the long term, having too much glucose in the blood can be a detriment. So if we look at all these endocrine organs, they all work in a feedback loop with each other. It was described back in the 30s by an endocrinologist, and this fact has sort of been left behind, is that the organs all work in a feedback loop with each other. So if the adrenals are working really hard, the other ones will slow down to try and compensate. There's only so much base material to go around. So usually what happens, what I find in my experience, is that the adrenals get the lion's share of those base ingredients, because survival is our main goal, is to make sure that we're alive. Survival of the species, survival is what overtakes everything else. So it doesn't matter if you can make babies if you're under stress. It doesn't matter if your blood glucose is balanced. It doesn't even matter if you're hot or cold as far as thyroid balance goes. All those things don't matter when there's a perceived stress, because survival is the key. And that's what I've found, especially with the reinforcement of our society saying all this other stuff doesn't matter, balance doesn't matter. What we really need to do is get things done, get more done, get it done faster, and that is conducive to this fight or flight or sympathetic stress response in the body. So another important part of this is that through menopause, when the ovaries stop working, so menopause is when you stop your period, so really ovaries give up, what happens to those other hormones, estrogen and progesterone? I often ask people, well, where do you think, what do you think happens to those hormones when you go into menopause? Do they just stop working? Do you not make it anymore? Estrogen and progesterone are very important parts of our overall hormonal health, especially in women. Estrogen does a multitude of things beyond just producing babies or producing our periods. So when that goes away, the ovaries aren't working anymore. What happens is that the adrenals are meant to pick up the slack and make estrogen and progesterone as well. So if we look at the adrenals and what it has to do now, it has to make a lot of things. It has to make adrenaline, it has to make cortisol, aldosterone, testosterone, estrogen, and progesterone. That's a lot of jobs. And if we have a history of our adrenals being under stress, the chances are that it's not going to be able to keep up the slack. And at the time of menopause, I'm finding that menopause is much worse if your adrenal health is not as good as it should be. The shocking thing for me is that once I'm treating women who are in menopause and then they bring their daughters in for me to help them out, I'm finding that there are some women that in their 20s that already have adrenal fatigue and they're not even remotely close to being in menopause and their periods are already erratic. They've probably been put on some type of oral contraceptive to regulate their hormones, but that again is symptomatic treatment. Remember, it doesn't take away the problem. So, there's a lot of things that can go on that can cause imbalance early on that will affect us later on in life. So, I was talking about those precursors or the prohormones or the base material that's made. And really, most of the hormones are made from prohormone or steroid called pregnenolone. Pregnenolone comes from cholesterol that's made in the liver, and then pregnenolone is a base hormone that is turned into all these other hormones. I should say there's two exceptions. Thyroid hormone, thyroxine, is made out of iodine. It's a relatively small molecule, and it is actually made in the thyroid itself. And insulin is a very small molecule, also very reactive, and made in the pancreas itself. But all the other ones are made from this base hormone, pregnenolone. The amount of pregnenolone that is made is fixed. There's a certain amount that the body makes, and that is given out to the different endocrine organs depending on the needs. What tends to happen is that in times of stress, the adrenals will steal, it's called pregnenolone steal, they'll steal the pregnenolone from the rest of the tissues so that it gets the lion's share. And that's another reason why these other endocrine organs won't be able to function properly. If we look at some of the symptoms of adrenal stress, things like weakness, fatigue, depression, PMS, flooding or really scanty periods, perspiration, an inability to concentrate, lightheadedness, sweet cravings, insomnia, irritability, headaches. It sounds like just about everything, but because it affects us in such a global way, we can have many, many symptoms as a result of adrenal stress. And here is a very scary graph that I wanted to just throw up so that you could see, if we look at cholesterol going to pregnenolone, that's the base molecules that's made in the liver. Then we have progesterone being made, and it turns into things like DHEA. It turns into all the different testosterones. It turns into all the different estrogens, estriol, estrone, estradiol. And then on the other side, we can see all of the adrenal hormones are produced. We're looking at aldosterone and all the different cortisone and cortisols. And all that comes from those base molecules. So what we tend to do for adrenal stress is we can measure two things, DHEA and cortisol, as a measure of what stage of adrenal stress you're in. And here it is, the stages of adrenal fatigue. What typically happens when you have a major stressor in your life. Again, we looked at emotional and physical stressors. It can be one of those, it can be both of those, it can be a series of those types of things. Typically where I see things like that causes an alarm state to happen, which is the first stage, are things like you've moved, you got divorced, your mother died, your cat died, and then you developed some inflammatory process. It's all hand in hand of both emotional stressors and physical stressors, and it's really called life. That's what happens to us. So alarm phase is really where cortisol is being made in excess to try and feed the body all those sympathetic hormones that it needs to keep up the stress load. And DHEA, which is a precursor, will also be made in excess. So if we did some tests, we would find cortisol raised and DHEA raised. Then in the resistance phase, that comes afterwards, that means you've been in adrenal stress for a while, you get into resistance. And if we looked at your values then, what we'd see is that cortisol may look normal. Okay, this is the tricky one. Cortisol may be normal or it may be lowered. Key thing is that the DHEA, that precursor, is now suppressed. And this tells me that you've been in that alarm phase, that you're going 100 miles an hour, your body's going 100 miles an hour, but now the adrenals are saying, look, I can't keep this pace up. When is it going to stop? I need some help here. And then the cortisol will start to make its way down. Depending on when we take your sample, that's where the cortisol may be normal. So it's kind of tricky. It may look like everything's okay, but that's where looking at the DHEA is really important as well. Now, after a period of time and being in this resistance phase, the body is really having difficulty keeping going. And then it gets into what we would call fatigue or failure. And that's where now cortisol and DHEA is in the boots. You're not seeing it anywhere. And you're going into full system fatigue. And this is where I see a lot of people were coming in with chronic fatigue syndrome. They have multiple food intolerances. They may have fibromyalgia. They've had to change a lot of things in their life because they're unable to keep up the pace. And that's because the adrenals have been trying to pump out the majority of the hormones and everything else has been suppressed to cause imbalance. And finally it just says, right, I can't do this anymore, and all systems break down and fail at that point. And now I know it's sort of a dismal picture, but if we look at it from a natural health perspective, I always personally believe that you can always change your state. That the body always has this amazing ability to rebuild itself and change. And that's when you put the right things into place, then you can heal yourself. And we hear these stories over and over again. People who have terminal cancer, who have no hope, who are really not doing very well, and somehow they come out of it and survive. And that's that will to live, but it's also the dedication to make the changes that are needed to bring the body back into that parasympathetic, that rest and repose mode, and be able to allow the body to heal itself. In a sleep lecture that I do, I talk about just sleep for an hour and its problems associated. Most people, probably 95% of the people that I see, are suffering from some kind of sleep disturbance. And we talk about how in the eclectic days, or in the 1800s, when the natural medicine people were prescribing things, they would say, well, I want you to sleep. I want you to go and sleep in bed for 4 days. No, I want you to just lie there and just relax and sleep when you want to and wake up when you want to, read books, take it easy. But really, that's forcing your body into that parasympathetic mode so that you can heal. And a lot of people are not really into doing that kind of thing, but it can really have a profound effect on your body if you're in a really critical state. And, you know, when we look at that whole physiology, when you're lying down in bed, the ribs are able to expand, the other organs are out of the way, the liver can grow to about 3 times its size so that it has this increased capacity to detoxify and to bring the tissues back into balance by making them squeaky clean so that they're working really well again. Now, next I'm going to show you what I've recently found as a definitive test for adrenal dysfunction. It's a really quick test, and I'd be happy if all of you just would be my guinea pigs and take it right now. It was actually developed at St. Mary's Hospital in Toronto. Now what it is a picture of two identical dolphins. Now what they found in a study that they'd been doing ongoing was that it was very closely monitored, it's scientifically done, and it actually revealed that in spite of the fact that the two dolphins are exactly the same, that the more stress that you're under, that you would find differences in the dolphins. So what I want you to do right now is to, I'm going to show you the picture in a minute. If you can look at the two dolphins that are jumping out of the water. Look at them very carefully. Now they both are identical, all right? But look really closely to see if you can find differences. And if you find more than one or two differences, you're definitely suffering from some type of adrenal dysfunction, okay? So, you ready? Here we go. So is everybody under adrenal stress? Obviously, we can see, and the point that I'm trying to make here is that everybody is in some type of adrenal dysfunction. It's just the state of our world. It's really to what extent of adrenal dysfunction are we in. That's what I'm finding. Now, in all seriousness, let's look at the things that I typically do to try and assess for adrenal dysfunction and where you're at on that scale, and then we'll talk about ways that we can reverse the process. There's a really simple test, and it's not the test that I just gave you, but there's a really simple test that is a pupil dilation test. And you can do this one at home with your partner or with a friend and try it out. I used to do it really routinely in my clinic, but what I found is that everybody really suffers from it, the dysfunction. Everybody tests positive, so it becomes not a very useful test to me. But it's a good test to try at home just to give yourself a little indication of where you're at. What you do is you basically take a little pen light, flashlight, and you flash it in, you put it into your eyes. And what should happen is that your pupils should contract, and they should hold the contraction for 30 seconds. Okay? Because what you're doing, you're actually trying to get that parasympathetic response of contraction of the muscles. Okay? In sympathetic response, you want your pupils dilated so you can see everything so much better if you're in the dark or the light is changing. Pupils are usually forced dilated. Okay? And what I used to do is I'd, flash this in people's eyes, and what I found was that I'd count to maybe 5. Maybe some people I'd maybe get to 6 or 7, but nobody has ever gotten to 30. And that just shows me that the body generally is under a lot of stress and that we all have some kind of adrenal dysfunction. So because that didn't really give me a lot of very specific information, what I've now gone to is a saliva test. And I'll just talk about the differences of the tests for a minute. Usually if you go to your physicians, they'll be giving you blood tests. And blood tests are great as far as giving us a gross indication of what's going on. But if you think about the role of the blood in the body, it's to keep everything static. It's our transportation system. Okay? So if we've got hormones or a different substance in the blood, the body is always trying to keep that fairly static. Okay? But it's not generally an indication of what's going on in the tissues. Because the tissues are changing so rapidly, minute to minute, it's very difficult for the blood to be able to keep track of those things. And there's been several instances, and I'm sure you've heard examples, where people will have all normal blood values. I've heard this over and over again. He was at the golf course, he was having fun, he had just had his physical exam, everything was great, and then he dropped dead. It's like, how could that happen? Well, obviously, our blood tests are good for some things, but it lags in what's actually happening with the tissues. And so the beauty about saliva is what it does is it takes the saliva and it actually contains tissues that can tell us what's happening at the cellular level. So it gives us a picture that is right in the moment and that's a lot more sensitive than the blood. There also are urine tests that you can do for hormone analysis, and what that tells us is the metabolites of all the hormones that were on that graph that I showed you. And that is a good indicator as well. The only limitation with it or caveat is that I always want to make sure that the kidneys are working okay, because really the test is only as good as what's happening at the kidney level. And if there's changes in kidney function, then the urine test won't come up with things that are as accurate as we would like. So if there's some differences in urine and blood, then we might want to look at saliva and see what's happening. I typically use the saliva test called the Adrenal Stress Index. And specifically for adrenal function, what we're looking at are 4 points of cortisol production throughout the day, so we get an idea of what your cortisol rhythm looks like. Then we're looking at the cortisol burden. That is, how much cortisol do you make throughout the day? So it's really the area under the curve. How much is it that you're making? Then there's 2 indicators of insulin, because insulin is linked so closely to cortisol, and that is your fasting cortisol, so when you wake up first thing in the morning, and postprandial, which is after you eat. Okay. Also, there is a test for gliadin antibodies, which means your immune system is having a reaction to gluten. Gliadin is the protein in gluten. And then we look at IgA, which is immune function as it relates to mucous membranes in the body. And that's mucous membranes includes your digestive system, which gives us an indicator if there's some food intolerance there. So let's just look at the adrenal rhythm here for a minute. If we look at a normal cortisol rhythm, typically you should have really high insulin first thing in the morning, and then noon and 4 o'clock, and then midnight should just kind of ease down in a nice sort of way. And what's important about the rhythm is that depending on what variations in that curve, you could have a totally inverted rhythm where it's low, 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 and then at midnight it's propping up. And those are typically the people that are, say, dragging themselves around all day. All they can think about is sleep. All they want to do is hit that pillow. And then the minute they get into bed, what happens? But they're wide awake. They are just wired. They cannot get to sleep. Okay? And that cycle goes over and over again. And the difficulty with having a rhythm like that is it's very difficult on your own to reverse that rhythm once it comes into place. Anybody who's ever had any shift work, or if you have sleep difficulties, you can get weird rhythms. I've seen rhythms that are low, low and have a peak in the middle of the day. That sometimes would suggest to me that maybe there's some food intolerance going on, or maybe some insulin imbalance happening there. You can have peaks and valleys all over the map. So it's really important to look at the rhythm so that we can try and normalize the rhythm along with bringing that overall burden, how much cortisol you're making, either up or down, depending on whether you're in alarm phase or in failure or in resistance phase. So let's look at some of the nutrients that we would use for adrenal health. As far as vitamins and minerals go, I feel that they're really good supportives and something that we shouldn't have to use all the time. That if we really have a good diet, we're eating organic foods, we're eating a plethora of whole foods, vegetables and fruit and whole grains, then we should be getting the nutrients that we need. But in disease states, you do need to supplement. The adrenals are the biggest storers of vitamin C in the body. It's the biggest storehouse for vitamin C. So this is a really important vitamin to be giving the body back, especially in adrenal fatigue. Because you can think about it in that if the adrenals have to produce all of these hormones, then it needs more base material to make it. So if you've been under a lot of stress, you're most likely in deficiency of these nutrients. Also, B5 or pantothenic acid is very important. Fat and water-soluble antioxidants, a mix of both is really important. Antioxidants are a very important thing to have from a point of view of the body being able to sop up those oxygen-free radicals that are being formed as a result of us breathing every day. There's also free radicals being formed from all the chemical reactions that we do every day. So antioxidants really help us sop those up and decrease any DNA damage that can be done at the cellular level. So what I like to recommend is a good mix of a fat and water-soluble antioxidant. So, and I use a whole food version that has things like turmeric and rosemary and some citrus bioflavonoids in there to be able to give you both fat-soluble ones, so then we're talking about brain tissue being supported, and also water-soluble ones so the rest of the body is taken care of as well. Beta-carotene is very important to mucous membranes. It is the precursor to vitamin A, which helps mucous membranes stay puffy and happy and uninflamed and just in good working order. Dry mucous membranes, dry eyes, vaginal dryness, any urinary tract irritations, those kinds of things are all sort of dry mucous membranes, irritable coughs, those sorts of things. Beta-carotene is very important because it actually converts into vitamin A in the liver. So again, important liver function is really important here. Beta-carotene is also important in adrenal health. Selenium is a mineral that's very important to adrenal health as well. So getting a good overall supportive nutrient combination is very helpful in improving adrenal health. Now, if we look at the herbs for adrenal support, again, because we're talking about constitutional stuff, if there is complete adrenal failure or fatigue, so if you're in the state where you're not making much cortisol, DHEA, we do a lot of other values like insulin, if we test thyroid function, if everything is very low and you're feeling quite miserable, then typically what I would do is I would give you herbs to help support the HPA axis, which means hypothalamus pituitary axis. That's in your brain. The HPA axis produces stimulating hormones that are sent to all of your endocrine organs. And if that system is not working properly, which it probably isn't in adrenal failure and any other endocrine organ failure, then we want to support it to bring it back to life. The herbs that we would use for that are chaste tree berry and phosphatidylserine, which is not a herb but a supplement. Phosphatidylserine is actually an antioxidant, and it can be used in that situation. Remember I was talking about the graph of cortisol rhythm, and if there are peaks, phosphatidylserine is very good at blunting cortisol so we can bring that adrenal rhythm back into balance. Now, for, again, constitutional remedies, we want to improve elimination. Things like dandelion root, which is great for the liver, and dandelion leaf, which is great for the kidneys. If you can get dandelion as a juice, it's available out there in most health food stores. It's got both the leaf and the root, so it's a really nice basic supportive for the liver and the kidneys, which are two of your primary elimination organs. And by stimulating bile production, which dandelion root will do, then you can actually improve your digestive function as well. Because constipation is really quite a big problem. If you're keeping all your toxins in your system instead of getting rid of them, you can have lots of backups and funky things going on, and in the long run it can cause a lot of problems. What you're really doing is multiplying by 10 the amount of toxins in your body, which is going to throw off your balance completely and make that immune, endocrine, and nervous system go wild and not function properly at all. So in some cases, chronic constipation can be the root of a lot of endocrine problems. Also, artichoke is an excellent herb that I like to use in women's health for liver support. It also supports healthy insulin balance. It also decreases bad cholesterol and increases good cholesterol. There have been several studies that have proven this. So it's a very, very nice women's herb because, as we know, in menopause, what happens due to the lack of estrogen is you get raised cholesterol and end up having, majority of people in menopause end up having a lot of cholesterol imbalance problems. But artichoke can help to keep cholesterol at a normal level. Also, another thing that helps with cholesterol, as an aside, are things like having the right essential fatty acids in your body so that you have good fats, so that the liver doesn't work so hard at making the bad fats, which really is cholesterol. Another herb that is great for mucous membrane health is calendula, or marigold. I'm sure you've all seen or heard of marigolds. We're talking about the Calendula officinalis, which is the sort of bigger marigold that's out there. And it's great for maintaining mucous membrane health. So because we are talking about the major elimination organs, we've got the liver taken care of, we're looking at healthy kidneys, and the mucous membranes of the digestive tract and the rest of the body. If they're in good health, then you can go a long way to supporting overall good hormonal health. Now, specifically for adrenal health, herbs that improve adrenal function, sort of normalize or dampen the stimulating effect or prop up the adrenals if they're in failure mode, are herbs called adaptogens. What they do is they help you adapt to stress. Okay? Now, clearly, as I was talking about a little bit earlier, we do need to do some lifestyle changes. Clearly, it's not really good enough to just take your herbs or take your supplements and keep your life exactly the same. Again, in contrast, the allopathic approach is very much take your symptomatic remedy, the symptom goes away, you can maintain your pace, and life will be okay. But as we said before, that underlying process still goes on. The imbalance and the destructive process in the body still goes on. So you can pay for it now or you can pay for it later. That's the way I always look at it. So with adaptogens as herbs, we can look at that as a piece of the picture that is going to help you support your body. I always say to people who come to see me that we can kind of keep you in a holding pattern so you feel a little bit better, but until you release those mostly emotional stressors that are going on in your life, you're not really going to get back into complete adrenal health or hormonal health for that matter. And those are sometimes the harder things to sort out. But adaptogens, things like Siberian ginseng, which is actually not a ginseng, but it is from Siberia. Its Latin name is Eleutherococcus, which you might see on some of the combinations that you might read about. But it is a great adrenal adaptogen or tonic, so it helps modulate the effect of the adrenal glands. An Ayurvedic herb called ashwagandha is another great adrenal tonic that I like to use, and rhodiola. Rhodiola is a Chinese one. So this is just an example of the adrenal herbs that you can use in combination to be able to improve your adrenal health. And typically I like to try one adrenal herb or maybe a couple because everybody reacts a little bit differently to each different herb. So the trouble with a lot of combinations that are out there is that they sort of pile all the adrenal herbs into one and then hope that one of those is going to work for you, but sometimes you can get overstimulated. So it's always better to try less sequentially and see which one is right for you. Because like people, herbs very much have personalities as far as what type of condition or person they treat. And I usually like to match up that with the herb so that we can get the right fit. So we talked about that connection between the endocrine, immune, and nervous system. So it's very important to support we talked about the hypothalamus pituitary axis. We're going to support our elimination organs. We'll support the adrenal glands. And now let's look at supporting the immune system and the nervous system. This is the whole big picture. Okay? And often people will say to me, I'll start them off on a couple things and then it sort of builds and builds until you may be taking quite a number of different combinations to try and support different parts of your body. I always like to say that the number of things that you're taking will have a crescendo and a decrescendo, so that as your body starts to heal, then you should need less and less of these things. Because after all, if we truly are doing constitutional therapy and bringing your body back into balance, then eventually, when the stress is lifted, when your life has changed, when you're living in complete balance, then you shouldn't need these supplements anymore. So let's look at some immune system modulators. It's very important that the immune system is kept healthy. Because immune dysfunction with endocrine dysfunction, with adrenal stress and raised cortisol can cause, over time, a lot of autoimmune conditions. Okay? If the immune system starts to dysfunction, then it can lash out and attack a bunch of different parts of our body. So immune system support is always a really good thing to do. And some great ones that I like to use that are really truly modulators, so they'll dampen the immune response if it's too robust, and it will prop up the immune system if it's being depressed. And those are things like Echinacea. It's not true that Echinacea can only be used for 10 days. It is safe, and there's been several studies to show that you can use Echinacea on a continuous basis without having a problem. Astragalus is a Chinese herb, and it's very, very good at modulating the immune response and can be taken for a long term. Then there are herbs like the medicinal mushrooms. And those are the ones particularly that I like to use, are Ganoderma and Shiitake, but there are many, many more that have immune modulating effects. So if you get a good immune modulating mushroom combination, it can be very good for you as well. Now, as far as the nervous system goes, because we want to round it out and support all the different areas of the body, of course, if we can do things like starting to meditate, not working as hard, getting to sleep on time, decreasing your stress load, all of those things are really good at decreasing your stress and improving nervous system function. Eating your food really slowly. You know, I don't know if you remember the comedian Bob Newhart. He used to say that his mom would make him chew his food 32 times before he swallowed it. So I don't know when the last time was that you actually sat down and had a meal without reading the paper or without watching TV or doing something else to maintain your mind. But if you could just eat and take in the quality of the food and the texture of the food, that is a very parasympathetic, relaxing activity. So even that goes a long way to decreasing stress. Also, there's a book out called The Thrive Diet by Brendan Brazier, who's a professional triathlete here in North Vancouver, who talks about actually foods that decrease cortisol and inflammatory processes in the body. His goal is to actually decrease his training time so that he increases his competitive edge, and he is a vegan. So it's a really great read to look at foods if you're interested in foods decreasing your stress level as far as digestive function goes. But let's look at the nutrients. We definitely need a good B vitamin combinations. If you're looking at a food state B vitamin, nutritional yeast is excellent because it has all the natural occurring B vitamins in it in a nice balance. Essential fatty acids, particularly for nervous system, DHA. There's two main essential fatty acids in the omega-3s, and that's EPA and DHA. And if we're looking at a good nervous system supportive, DHA is the one that's thought to really improve nerve function. And the reason for that is that DHA actually helps to form that nice cushy lining around your neurons, so there's not weird electrical conductions that go back and forth between the nerves. That's what causes your jitteriness in your body. So B vitamins are important for that, as are essential fatty acids. If you're talking about herbs, we call them relaxing nervines, so they help to relax the nervous system. And those are things like wild oats, passion flower, and skullcap. And then as well, for nutritional support, if we round it all off by saying, okay, we've supported everything we can think of, right? The primary elimination organs. We have supported the nervous system, the immune system, the adrenal organs. And now what we want to do is round it off by saying we should always eat very well and try and decrease our stress. And I've just mentioned the book, The Thrive Diet, which talks about actual foods that decrease cortisol and inflammatory process in the body. But sort of general guidelines for nutritional support are really taken as a modification of the Gerson diet, which is an extreme diet that is used for really severe life-threatening conditions, but can be used in different ways in your everyday life is juicing vegetables. We don't get enough of our vegetables, and often when I'm speaking in programs, I'll feel like everybody's mom because I say, well, eat your vegetables. And it really is true that vegetables are the key to keeping us healthy because it contains all the minerals and vitamins that we need, and tons of fiber, so they really are our key cornerstone of our health. Many times people can't take in the recommended 5 half cups of vegetables a day. So juicing is a way that you can get around that by juicing vegetable juices or purchasing vegetable juices, good quality vegetable juice that's low in sodium, and having several glasses of those a day. Then you can go a long way to improving your health. And in the Gerson therapy, they recommend 8 to 12 glasses a day. And that's when you're in a situation like adrenal fatigue or endocrine dysfunction. Definitely you want to be able to give your body those nutrients so that you're giving it the nutrients in a way that are really well absorbed, so that your body can be flooded with nutrients so that it can start healing itself and bringing it back into balance. Certainly one of the key points about the juicing, and the reason why I bring it in here as a way of maintaining your health, is that whole foods are so important to keeping us healthy. Very different from taking a supplement. And in my talk about whole food nutrition, I'll talk about that in greater detail. But certainly I think if you think about it intuitively, that if you were to take a supplement, deep down in there somewhere that it's not the same as if you eat a vegetable. I know there's lots of marketing out there that tell you differently, but it really isn't the same. It's been dried, it's been isolated. A lot of supplements that are out there don't even come from plants. They're completely synthesized nutrients, and they're not even remotely the same as what you get in a plant form. And yet we're taking them with the faith that this is going to be helping us in some kind of way. And in fact, in that lecture, I'll give you some examples of that, especially at high doses. Some of these nutrients can really be detrimental to your health. Hydration is also very important. I talked about dehydration being a cause for physical stress in the body. So keeping our bodies filled with liquid is a very important thing to do. And the rule of thumb is that you take your weight, you divide it by 2, and that's the number of ounces that you need to drink in a day. So your weight in pounds divided by 2, and that gives you the number of ounces. There's 8 ounces in 1 cup, and that'll give you an idea of how many cups you should drink in a day. Again, as another rule of thumb, please do not drink from 0 glasses a day to your 10 or whatever it turns out to be the next day. Because what will happen is that you will just pee out all your nutrients, everything that your body is trying to keep in. Okay? What we need to do is slowly equilibrate our system so that we're increasing 1 cup every other day or even 1 cup a week, so that over a period of time our body gets used to that increased fluid load and it's able to utilize it at the tissue level. Okay, so your weight divided by 2 gives you the number of ounces you should drink a day. And if you're drinking caffeine or any drinks that contain sugar, you need to add an extra cup for every cup of those other liquids, because those sugars and caffeine act as diuretics to increase the amount of water removal from your body. Okay, but the good news is that herbal teas count. So that's why I'm always my sort of push, my little marketing ploy to get people to drink herbal teas. Also, manual therapies I think are really, really important. So I'm really working at physically trying to get your body back into health. The manual therapies like massage and lymphatic drainage and Pilates and cranial sacral therapy, these are all things that are very helpful to bringing the body back into balance. It speeds up the process. Acupuncture, Reiki, reflexology, these are all things that really help, and you can add that into your regime to whatever suits your fancy to be able to bring you back into health. Another important part is actually visualizing health. We talked about perception changing your genetic code. The gentleman I spoke about was Dr. Bruce Lipton, and his book is called The Biology of Belief. And when I think about that, what I try to do is close my eyes and think about when I felt the greatest. And for me, it was when I was 11. I don't know how I came up with that, but I can picture myself as 11 in a certain situation, and I feel great. I used to run everywhere. I ran everywhere until I was 11 or 12. I don't know what happened after that. Puberty, it kind of messes up your running ability or something. But if you can sit back and think about yourself in that picture and then bring it into your present day and kind of go through a bit of a meditation as to how it feels in your body to feel that way. There's also more directed meditations that you can do of increasing blood flow to certain areas of your body and doing very specific healing techniques. But certainly overall visualizing health is a really important part of getting you well. Because if you really in your core at your tissue level believe that you have the capacity to heal yourself, you will probably be more committed to making the changes, and it will be much better physiologically. Your body will enable itself to do that process. And again, in my lecture about whole food nutrition, we'll get into it, but really try to eat as much as possible whole foods in their most digestible form. Okay, so not boiled to crap if you're going to do the vegetables, or not raw all the time if you've got a digestive system that's a little bit touchy. And really, in today's society, I think that, again, as with adrenal health, most people's digestion is not optimum either. So we need to give the body nutrients that are going to be absorbed easily, that are going to be assimilated, but then utilized in the body in an appropriate way. So I hope I've given you a good sense and some places to go as far as looking at your adrenal health, where it may stem from, looking at the bigger picture, and then giving you some starting points to be able to make sense of it all and trying to support your system in a way that will bring your body back into health.